Hi everyone, my name is Elena Quintanilla and today I'm going to talk about hepatocellular carcinoma. Definition: hepatocellular carcinoma is a primary malignancy of the liver that occurs predominantly in patients with underlying chronic liver disease and cirrhosis. However, up to 25% of patients have no history of cirrhosis or risk factor for it.
Hepatocellular carcinoma is a type of cancer that arises in liver cells. It can sometimes be associated with chronic inflammation due to hepatitis and cirrhosis. And it can be a challenging cancer to deal with because patients have two things to deal with, usually the cirrhosis as well as the cancer. And traditionally, there haven't been very good targeted therapies or chemotherapies for it, but in the past few years, we've seen a lot of new drugs developed for hepatocellular carcinoma, which is very exciting. For over 10 years, we only had one drug, and most recently, we have a new first-line therapy called lenvatinib, and we also have 4 other second-line therapies: regorafenib, cabozantinib, pembrolizumab, and nivolumab. So we've got a lot of new targeted therapies and immunotherapy, so it's a very exciting time for this type of cancer.
Application in medicine. The presentation of hepatocellular carcinoma has evolved significantly over the past few decades, whereas in the past patients with hepatocellular carcinoma generally present at an advanced stage, with right upper quadrant pain, with loss and sign of descompensated liver disease. Hepatocellular carcinoma is now increasingly recognized at much earlier stage as a consequence of the routine screen of patients with no cirrhosis, using ultrasonography with or without serum alpha phenylprotein measure.
Hello guys, this is Indian Medico, and in this video we are going to see about hepatocellular carcinoma. Treatment of hepatocellular carcinoma. The various treatment options include surgical resection, chemotherapy, radiotherapy, and liver transplantation. Now let us see about the prognosis of hepatocellular carcinoma. Death often occurs within 10 months of diagnosis in case of hepatocellular carcinoma. If you have any suggestions, please let me know in the comment section. For more such videos, please check out my playlists. If you like my videos, kindly subscribe. Your subscription will encourage me to make more videos. Thank you.
Pros and cons. Liver transplantation remains the best option for patients with hepatocellular carcinoma. Unfortunately, the supply of good quality deceased donor organs is limited. Thus, other treatments, including resection, radiofrequency ablation, and potential system therapy with sorafenib, with regorafenib, nivolumab, lenvatinib, pembrolizumab, cabozantinib, or ramucirumab, should be used to bridge patients to transplantate or to delay recurrence if possible.
Hepatocellular carcinoma is a primary cancer of the liver. It's a cancer that develops primarily in patients who have liver cirrhosis. It's the third most common cancer in the world and one of the leading causes of cancer death. The reason it develops is because when patients become cirrhotic, their livers become nodular and inflamed, and tumors develop in these inflamed nodules. The major cause for hepatocellular carcinoma has been hepatitis C, which has been one of the leading causes of cirrhosis. But more recently, we're seeing increasing numbers of patients with hepatocellular carcinoma who have fatty liver disease and have fibrosis, not just cirrhosis. So any inflammation in the liver can cause these tumors to develop. For most patients with hepatocellular carcinoma that present to our center, we evaluate them for liver transplant. If they come in with in the setting of cirrhosis. The other option is surgical resection or cutting the tumor out. And for those patients who are not suitable for transplant for one reason or another, they may be suitable for resection. Not everybody is suitable for resection, and it depends how bad the liver disease is, clearly. And the third modality is treatment from the interventional radiologist with either wires that go into the tumor and burn them from the inside with chemotherapy, or burn them from the outside through wires that come into the liver from the outside. All of these can be combined to get the best results for the patient. The advantage we have at New York Presbyterian for treating such a challenging disease is that the surgeons here are capable of resecting and transplanting the livers. We have experts in interventional radiology at treating these tumors. When you have a multidisciplinary team that's composed of surgeons who do research on the disease, who can cut the liver out or can transplant the liver, as well as hepatologists who are invested in researching the disease, and oncologists and radiologists, you get a better result for the patient overall. And the patient is directed towards the most appropriate care, rather than being filtered into what the center is an expert at. We're an expert at all three modalities of treatment rather than just the one.
Issue applied in Ecuador. At Hospital de Solca, Guayaquil, a total 67 male patients with hepatocellular carcinoma were analyzed with an average 64.6 years old. The 3% of patients originally from Guayas, 40% lovers, and 20% only in student elementary school. The associated variables were cirrhosis stated 20%. The infection due to hepatotropic virus 32.8% and insulin resist 25%. The most important risk factor combination being diabetes mellitus plus obesity 20%. HPP plus cirrhosis 19%. The first being exclusive from the no-cirrhotic group. In conclusion, hepatic resection and transplantation remain the concern curative therapy for patients with hepatocellular carcinoma. In patients with early-stage tumors and advanced liver disease, transplantation is clearly the treatment of choice with 5-year survival rates of roughly 70%. Liver transplantation, however, is limited by organ shortage and the inherent risk of transplantation and immunosuppression.
Hepatocellular carcinoma. Chronic hepatitis B is the most common cause worldwide. Chronic hepatitis C is the most common cause in Europe. The main risk factor for developing hepatocellular carcinoma is liver cirrhosis, for example, secondary to hepatitis B and C, alcohol, hemochromatosis, and primary biliary cholangitis. Features. Tends to present late. Features of liver cirrhosis or failure may be seen: jaundice, ascites, right upper quadrant pain, hepatomegaly, pruritus, splenomegaly. Possible presentation is decompensation in a patient with chronic liver disease. Screening with ultrasound, with or without alpha-fetoprotein, should be considered for high-risk groups such as patients with liver cirrhosis, secondary to hepatitis B and C, or hemochromatosis. Men with liver cirrhosis secondary to alcohol. Management. The only proven potentially curative therapy for hepatocellular carcinoma remains surgical. Either hepatic resection or liver transplantation. Hepatic resection should be considered as a primary therapy in any patient with hepatocellular carcinoma and non-cirrhotic liver. Liver transplantation should be in any patient with cirrhosis and a single small hepatocellular carcinoma less than 5 centimeters, or multiple up to 3 lesions less than 3 centimeters. Non-surgical therapy is only used when surgical therapy is not possible, and with extrahepatic dissemination. Percutaneous ethanol injection has been shown to produce necrosis of small hepatocellular carcinoma, and is best used in peripheral lesions. Transarterial chemoembolization can produce tumor necrosis, and has been shown to affect survival in highly selected patients with good liver reserve. Radiofrequency ablation. Systemic chemotherapy has a poor response rate. Sorafenib, a multikinase inhibitor. Interferon has been used as the treatment of hepatocellular carcinoma, rather than the underlying viral infection, but remains controversial. Thank you for watching. New videos are uploaded regularly. Don't